Hi everyone. So breast implants do not last forever. So when should you consider changing your breast implants? Well, this is a big topic and I'm going to break it down into for those women who have saline implants. If you had breast augmentation surgery between the years of 1996 to 2006, there's a 100% chance in this country that you had saline implants. So because of the fact that it's been over 10 years, you should strongly consider switching out your saline implants for silicone implants. The reason why is that the shell of these saline implants are weaker now than they were 10 years ago, and there's a higher chance that they're going to rupture. So to prevent them from rupturing, you should strongly consider switching out your saline implants for silicone implants. Silicone implants definitely are softer, and in some cases may actually even be lighter than saline implants because of the density of the gel is in certain cases lighter than saline. So, and they definitely feel much softer than saline implants. Saline implants may also have a higher chance of rippling than silicone implants, and depending upon what the soft tissue envelope of the breast is, a lot of women now have had children compared to in the 90s and 2000s when they had their saline implants. So their breasts looked a certain way back then. They might have been perky, they might have been round, and they might have had a really beautiful shape. But after having had children, there's obviously breast sagging or ptosis. So now, not only do you have saline implants that are higher risk of rupturing, but the breasts are probably sagged because of having had children. So it's a great time to consider switching out your saline for silicone implants, and you may consider a mastopexy or a breast lift. And I may talk to my patients about also doing a breast lift at the same time that the implants are switched out to maintain a really nice, beautiful shape now that you're done having children. So saline implants also, in some cases, because they're salt water, they kind of move around in the shell, and you may have a swishing and sloshing sound. That doesn't happen that often, but in some cases it does, and with silicone implants, obviously that's not the case. The other thing is that with silicone implants, we have so many different options. I have so many more options in 2017 than plastic surgeons had back in the early 2000s. And so that allows me to offer the best, most appropriate implant for that particular patient, depending upon what her goals are. So now we have smooth, textured implants, round anatomic implants, and different implants with highly cohesive gels with different fill volumes and ratios. So without getting too technical, what that basically means for you or for my patients is that I can tailor the best implant for that particular patient. So, the science of breast augmentation surgery continues to evolve. We're better at breast augmentation surgery today than we were 15 or 20 years ago. There's more implants today than there was 15 or 20 years ago. There's better techniques. There's the use of a Keller funnel, all those things that I employ. So I constantly strive to be on the cutting edge of science with respect to breast augmentation surgery, and that allows me, as a board-certified plastic surgeon in Houston, Texas, to provide the best care for my patients, to give them the best and absolute results possible with the use of the latest and greatest in terms of the technology associated with silicone implants. So, as always, hopefully this was helpful. If you or anybody that you know has saline implants, feel free to share this video. I found it to be very informative, and most of my patients find this type of information to be very informative. And as always, thanks for tuning in, and please feel free to follow us on Facebook, like us on Instagram, and for more of my thoughts on this particular subject, I go into a little bit more detail. You can follow us on my blog on our website at bodybyravi.com. So thanks for tuning in, and I look forward to the next video.